way we provide mental health care in New South Wales is changing. The New South Wales Government is committed to delivering several strategic mental health reforms, including investing in capital that will reshape mental health service delivery and facilities in which those services are delivered. The government's going to invest $700 million over the next 10 years to implement the state's biggest ever mental health infrastructure reform program. We know mental illness has a significant adverse effect on our community. In fact, almost half of all Australians aged 16 to 85 will experience a significant mental health issue at some point during their life. We know that the right care in the right environment at the right time is crucial to recovery.
We don't just build facilities anymore, we build places which are helping people get better, which is helping wellbeing. And if we do that through co-design, then we're just working with the right people from the beginning. We're not just building a facility and hoping that it's going to work. One of the first therapeutic environment minor capital works projects is here in Coffs Harbour and involves artwork and integration. It's about getting people more comfortable with the environment to improve that wellness opportunity. We will cover a range of different facilities for different needs in different parts of the community.
So this program is dedicated to reform. It's all about filling the gaps in the system through providing new assets that enable new and modern models of care, whether it's the high acuity that we have in some of the forensic patients. We've got older persons units, we've got child and adolescents, we've also got the pathways to community living, which will see people come out of the hospital setting into a home-like environment. And we've got the mothers and babies unit.
So the mother and baby unit will be the first publicly available mother and baby unit in the New South Wales health system, and it's critical that we support women experiencing mental illness at an extremely vulnerable time. So the purpose-built unit will provide specialist inpatient care for new mums and their babies, helping to support their bonding and attachment as the women recover and helping them reconnect with their families.
So we're here on the site of Stage 2 of the redevelopment of Campbelltown Hospital, and in the planning for this redevelopment, the older person's mental health unit was identified as a priority. This unit will support us to deliver integrated quality mental health services. We've all worked together from the start, community members and clinicians, and that's why we believe this project will be really successful.
It's really important to have true partnerships and co-design where our consumers and carers have equal input to the environment that we provide.
It's only by having those conversations that we can actually discover some really important solutions and directions that we need to go in to meet the needs of the consumers that we're serving.
In my ideal world, a therapeutic environment would be soft and gentle and more homely, the mental health ward, rather than sterile. It would also make sure that consumers and carers have had a voice in how the facility looks and also the program that's run there, because they have different insights to the workers.
Sometimes those conversations can actually highlight some small changes that prove to be incredibly important for the journeys that our consumers are taking on their road to recovery.
Part of the excitement about this program is that it's not the same everywhere. It's not a cookie cutter approach, it's different. So we need to be bespoke and we need to be co-designing and collaborating with the people who are actually going to be using those facilities.
It is so important that these people that are travelling through their struggles with mental health, that they have got appropriate facilities to allow that current model of care that they need to get the best treatment.